We come into this line of work because we're compassionate and because we want to make a difference. And for such a long time, it's been a part of our culture that being abused in some ways was just part of our job. And it's not part of our job. There's no other job you'd have where it was acceptable to be hit, kicked, spit upon, cursed at. And it's time for it to stop. The incidences have gotten worse along with the injuries with the onset of the opioid epidemic, because people are completely not in control of themselves when they're impaired or coming down off of some of these medications, and it's increased the violence and the aggressive behavior towards healthcare workers. And I'm one of a growing number of people, members of professional organizations across the country, across the state of Kentucky, KONL, KNA, ENA. We're standing up and saying something has to change. And so as a caregiver, as someone who goes into a profession of caring, you're really torn between what do I do and how do I give the best care, and how do I also set limits and boundaries so that I'm not injured. So I believe it has a huge effect on nursing turnover, because why would you continue to work and be abused like that? And I think organizationally across the country, we really don't do enough to support them, to educate them, to prepare them that those are the things we're trying to see. And some of the work that is going on now with KONL and KNA and ENA, that's what we're trying to do, is to better prepare people. KNA actually sent a letter of recommendation to the college deans of nursing all across the state of Kentucky saying, please add this education to your curriculum. Our nurses need that. They're coming out of school and they're completely unprepared. And when you talk about workplace violence too, don't forget, you're talking about everything from bullying to active shooter. I mean, that's a huge range of topic to try to tackle as an organization, and it's going to take all of us getting on the same page and working together to figure out how to make it stop, how to make it better, how to get each other through it. This is such an amazing job. Being a nurse enables you to do so many wonderful things, and like I said before, to step into people's lives at their worst moment and truly make a difference. How many jobs can you have where you say that? Because nursing's not just a job. And so the calling to go into that line of work is a very strong one, and to know that they're leaving because they're suffering, because they're in pain, or because they're afraid, to me is very sad.